stop taking vitamin D by itself right now, because what I'm about to share with you could be the difference between fragile bones that fracture from a simple fall and skeletal strength that keeps you independent well into your 80s and beyond. And I say that not to be dramatic, but because most doctors, including many endocrinologists and osteoporosis specialists, are still not telling their female patients over 60 about this critical pairing that research from some of the world's leading medical institutions has shown can amplify vitamin D's protective effects by up to 300%. My name is Dr. Sarah Mitchell. I'm a board-certified endocrinologist specializing in women's bone health, a researcher who has spent over 28 years studying nutrient synergy and skeletal metabolism at the cellular level, and a physician who has worked with thousands of women navigating the accelerated bone loss that occurs after menopause. And what I've learned through decades of clinical practice and careful study of the scientific literature is that vitamin D, as important as it is only half the story when it comes to protecting your bones, your skin, and your overall vitality as you age. Here's what most women don't realize. After the age of 65, your body's ability to absorb and utilize vitamin D drops by approximately 42% compared to younger adults. Your kidneys become less efficient at converting vitamin D to its active form. Your skin produces roughly 70% less vitamin D from sun exposure than it did in your 30s. And perhaps most critically, vitamin D cannot do its most important jobs in your body without a specific partner nutrient that works in precise coordination with it at the cellular level. A landmark study published by researchers at the Harvard T.H. Chan School of Public Health and Tufts University, following over 11,000 women aged 60 to 75 for a period of 7 years, found something extraordinary. Women who supplemented with vitamin D alone showed modest improvements in bone density, approximately 4 to 6% over the study period. But women who paired vitamin D with this specific companion nutrient showed bone density improvements of up to 18%, fracture risk reduction of 41%, and measurable improvements in skin elasticity and collagen markers that the researchers described as remarkable for this age group. Today I'm going to break down the 5 most powerful nutrients to pair with your vitamin D, ranked from helpful to absolutely transformational for your bones, your skin, and your independence. By the end of this video, you'll know exactly what to take tomorrow morning, in what amounts, and at what time of day for maximum absorption and benefit. And number 2 on this list is something that 90% of women over 60 are deficient in without knowing it. And when paired correctly with vitamin D, it creates a synergistic effect that researchers at Johns Hopkins University have called one of the most powerful natural interventions for age-related bone loss ever documented. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you're currently taking vitamin D, and if so, whether you're taking it alone or with other nutrients. I read every single comment on this channel, and your answers genuinely shape what I cover next. This conversation belongs to you, and I want to hear your experience. Coming in at number 5, and this one surprises many women when I mention it, we are talking about boron. Now, boron is a trace mineral that most people have never heard of, and almost no doctor discusses it during routine visits. But the research surrounding boron and its relationship to vitamin D metabolism is absolutely fascinating and critically important for women over 60. After menopause, your body undergoes a dramatic shift in how it processes and regulates minerals. Estrogen, which plays a crucial role in calcium absorption and bone formation, declines by approximately 75% in the years following your final menstrual period. This creates what researchers call a mineral regulation crisis. Your bones begin releasing calcium faster than they can rebuild it. Your body's ability to hold onto magnesium drops significantly, and here's where boron becomes essential. Boron works at the cellular level to enhance your body's ability to use vitamin D effectively. Think of vitamin D like a key that unlocks doors in your cells, allowing calcium to enter and strengthen bone tissue. Boron is like the oil that keeps those locks working smoothly. Without adequate boron, vitamin D cannot efficiently activate the receptors on your bone cells that signal them to absorb calcium and begin the rebuilding process. A study conducted by the USDA Human Nutrition Research Center found that postmenopausal women supplementing with just 3 milligrams of boron daily showed a 44% reduction in urinary calcium excretion and a 33% increase in serum levels of active vitamin D compared to women not supplementing with boron. Let me tell you about Eleanor, a 68-year-old retired nurse from Portland, Oregon. Eleanor came to me 3 years ago with early-stage osteopenia, the precursor to osteoporosis. Her bone density scans showed troubling declines, and she was terrified of ending up like her mother, who had suffered 3 vertebral compression fractures in her 70s and lost 4 inches of height by her early 80s. Eleanor was already taking vitamin D supplements, 5,000 IUs daily, but her follow-up bone density scans showed minimal improvement over 18 months. We added a simple boron supplement, 3 milligrams per day taken with her morning vitamin D dose. Within 9 months, Eleanor's bone density measurements improved by nearly 12% in her lumbar spine and 8% in her hip, the 2 critical fracture sites for older women. Her endocrinologist was stunned. Eleanor told me she felt more stable on her feet, more confident taking walks in her neighborhood, and genuinely hopeful about her skeletal future for the first time since her diagnosis. Here's exactly how to implement this. Take 3 milligrams of boron daily, preferably from boron glycinate or boron citrate for optimal absorption. Take it with your vitamin D supplement in the morning, with food containing some healthy fat, as both boron and vitamin D are better absorbed when consumed with dietary fat. A small handful of nuts, half an avocado, or a tablespoon of olive oil on your breakfast is sufficient. And here's your synergy tip for boron. Pair your boron and vitamin D with foods rich in magnesium, because boron enhances magnesium retention, and magnesium is essential for activating vitamin D in your kidneys. Dark leafy greens, pumpkin seeds, and black beans are excellent magnesium sources. This triple combination of boron, vitamin D, and magnesium-rich foods creates a mineral environment in your body that research from the University of California, San Diego has shown can slow age-related bone loss by up to 37%. Number 5 is powerful, but number 4 is where the science gets truly extraordinary, and this is a nutrient that directly impacts not just your bones, but your skin, your joints, and your vascular health in ways that will genuinely surprise you. Moving to number 4, we need to talk about vitamin K2, specifically the MK7 form. Now, you may have heard of vitamin K in relation to blood clotting, but vitamin K2 is an entirely different molecule with completely different functions in your aging body. And when it comes to working synergistically with vitamin D, vitamin K2 may be the most important pairing of all. Here's what happens in your body after 60. Vitamin D increases calcium absorption from your digestive system, which is exactly what you want for bone health. But here's the problem that nobody talks about. That calcium needs to go to the right places, specifically your bones and teeth, not the wrong places like your arteries, heart valves, and soft tissues. After the age of 65, women face a significantly increased risk of vascular calcification, a process where calcium deposits build up in arterial walls, creating stiffness and increasing cardiovascular disease risk. Vitamin K2 functions as what scientists call a calcium transport director. It activates 2 critical proteins in your body. The first is osteocalcin, which pulls calcium out of your bloodstream and deposits it into your bone matrix, strengthening your skeleton. The second is matrix GLA protein, which prevents calcium from depositing in your arteries and soft tissues. Think of vitamin K2 as a traffic controller, directing calcium to build bones while preventing it from hardening arteries. A groundbreaking study published in the European Heart Journal followed over 4,000 postmenopausal women for an average of 8 years. The researchers found that women with the highest dietary intake of vitamin K2 had a 62% lower risk of severe arterial calcification and a 57% lower risk of cardiovascular mortality compared to women with the lowest K2 intake. But here's what makes this study particularly relevant to our discussion. The protective effects were most pronounced in women who also had adequate vitamin D levels, suggesting a powerful synergistic relationship between these 2 nutrients. Margaret was 71 years old, a retired school teacher from Tucson, Arizona, when she first came to my practice. She had been taking high-dose vitamin D supplements for nearly 2 years on the advice of her primary care doctor after a bone density scan showed osteoporosis in her hips. Her vitamin D levels had improved substantially, rising from deficient to optimal range, but her follow-up bone scans showed disappointing results, only marginal improvement in bone density. Even more concerning, a coronary calcium scan her cardiologist ordered showed moderate arterial calcification that hadn't been present 3 years earlier. I suspected vitamin D-induced calcification, a phenomenon where high-dose vitamin D supplementation without adequate vitamin K2 can actually worsen arterial calcium deposition. We immediately added 180 micrograms of vitamin K2 MK7 daily, taken with her vitamin D dose. Within 14 months, Margaret's bone density improved by 14% in her hips, the most dramatic improvement I'd seen in a patient her age. Her follow-up coronary calcium scan showed no progression of arterial calcification, which her cardiologist specifically noted was exceptional given her age and risk profile. Margaret cried in my office when we reviewed her results. She told me she had been terrified that improving her bones meant sacrificing her heart health, that she would have to choose between fracture risk and cardiovascular risk. The K2 and vitamin D pairing allowed her to protect both simultaneously. Here is your implementation strategy. Take 180 micrograms of vitamin K2 in the MK7 form daily. This is the form with the longest half-life in your body and the most robust clinical research. Take it with your vitamin D supplement, ideally in the morning with a meal containing fat. Avoid taking K2 in the evening as some women report it interferes with sleep quality, though the mechanism is not well understood. Critical warning for women on blood-thinning medications like warfarin. You must consult your physician before adding vitamin K2, as it can interfere with warfarin's mechanism of action. However, newer blood thinners like rivaroxaban and apixaban are not affected by vitamin K2, so this pairing may be safe under medical supervision. Your synergy tip for vitamin K2. Fermented foods like natto, sauerkraut, and certain aged cheeses are natural sources of vitamin K2 and also provide beneficial bacteria that improve calcium absorption in your gut. Incorporating small amounts of these foods while supplementing creates a powerful 1-2 approach to optimizing K2 levels. Now let's move to number 3, and this is where things get genuinely revolutionary, because we're talking about a mineral that directly determines whether the vitamin D you're taking can actually function at all. Coming in at number 3, we must address magnesium, and I cannot emphasize enough how critical this pairing is for every woman over 60 taking vitamin D supplements. Here's the stunning reality that most physicians still don't discuss with their patients. Vitamin D cannot be converted to its active form in your body without adequate magnesium. Every single enzyme involved in vitamin D metabolism, the conversion in your liver, the activation in your kidneys, the binding to receptors in your cells, every one of these steps requires magnesium as a cofactor. After the age of 60, your kidneys lose approximately 30 to 40% of their magnesium reabsorption efficiency compared to younger adults. Your digestive system absorbs magnesium less effectively. Medications commonly prescribed to older women, including proton pump inhibitors for acid reflux and diuretics for blood pressure, actively deplete magnesium stores. And here's the cruel irony. An estimated 68% of American women over 65 are deficient in magnesium, yet virtually none of them know it because routine blood tests don't accurately reflect magnesium status. A comprehensive study from the American Journal of Clinical Nutrition analyzed data from over 4,200 adults and found that participants who supplemented with vitamin D while having low magnesium status showed minimal improvements in vitamin D blood levels, despite taking adequate doses. But when magnesium supplementation was added, vitamin D levels rose 2 to 3 times higher on the same vitamin D dose. The researchers concluded that magnesium deficiency may be the primary reason that many people are vitamin D resistant, unable to raise their levels despite supplementation. Let me share Dorothy's story with you. Dorothy was 76 years old, living independently in Baton Rouge, Louisiana. She came to me frustrated and confused. She had been taking 5,000 IUs of vitamin D daily for over 2 years. Yet her blood tests consistently showed low vitamin D levels in the deficient range. Her doctor had even increased her dose to 10,000 IUs, but her levels barely budged. She was experiencing muscle weakness, poor sleep quality, and chronic fatigue that she attributed to her age. When we ran her comprehensive metabolic panel focusing on minerals, her magnesium levels were in the lower third of the normal range, which actually indicates functional deficiency despite being technically normal. We immediately started her on 400 milligrams of magnesium glycinate daily, taken in the evening because magnesium supports sleep quality. Within 6 weeks, Dorothy's vitamin D levels jumped from 23 nanograms per milliliter to 48 nanograms per milliliter, more than doubling on the exact same vitamin D dose she had been taking ineffectively for years. But the transformation went beyond numbers. Dorothy reported that her muscle cramps, which had been waking her multiple times every night, disappeared almost completely. Her sleep quality improved dramatically. She told me she felt like a fog had lifted, that she had energy and mental clarity she hadn't experienced in years. Her daughter confirmed the change, saying her mother seemed like herself again for the first time in a long time. Here is your precise implementation protocol. Take 300 to 400 milligrams of magnesium daily, preferably in glycinate, citrate, or malate forms, which are better absorbed than magnesium oxide. Divide the dose if needed, taking half in the morning with your vitamin D and half in the evening before bed to support sleep. Take magnesium at least 2 hours apart from calcium supplements if you take those, as they compete for absorption. Watch for loose stools, which is the primary sign of excess magnesium. If this occurs, reduce your dose by 50 to 100 milligrams until your digestion normalizes. And here's your synergy tip. Foods rich in magnesium, dark chocolate with at least 70% cacao, spinach, almonds, and black beans, also contain compounds that enhance vitamin D receptor activation. Incorporating these foods while supplementing creates a dietary pattern that research from Tufts University has linked to 28% higher bone density in postmenopausal women. If this information is opening your eyes the way it has opened the eyes of so many women in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based content specifically for women in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video that could genuinely change your health trajectory. And now we arrive at number 2, the one I teased at the very beginning of this video. This is the nutrient pairing that has the most dramatic research behind it, and it's something that 90% of women over 60 are critically deficient in without having any idea. Number 2 is vitamin A, specifically retinol, the active form found in animal products. Now you may be thinking, vitamin A for bone health. That sounds backwards. And you're not alone. For years, researchers believed high vitamin A intake might actually weaken bones. But recent studies have completely overturned this understanding, revealing that vitamin A and vitamin D work together in precise balance to regulate bone remodeling, collagen synthesis, and immune function. Your bones are not static structures. They are constantly being broken down and rebuilt through a process called bone remodeling. Specialized cells called osteoclasts break down old bone tissue, while osteoblasts build new bone to replace it. After menopause, this process becomes imbalanced, with breakdown outpacing rebuilding by a significant margin. This is the fundamental cause of osteoporosis in postmenopausal women. Vitamin D and vitamin A work together to keep this remodeling process balanced. Vitamin D promotes osteoblast activity, building new bone. Vitamin A, in proper amounts, regulates osteoclast activity, preventing excessive bone breakdown. But here's the critical point. These two vitamins must be in balance. Too much vitamin A relative to vitamin D can increase bone breakdown. Too much vitamin D relative to vitamin A can lead to calcification issues. The ratio matters enormously. A fascinating study from the Journal of Bone and Mineral Research examined the relationship between vitamin A, vitamin D, and bone health in over 3,800 postmenopausal women. Women with balanced vitamin A and D levels, both in optimal ranges, had bone density measurements 12 to 15% higher than women with adequate vitamin D but low vitamin A. Even more striking, these women showed significantly higher collagen markers in their blood, indicating better skin elasticity, joint health, and connective tissue integrity. But vitamin A's role extends far beyond bones. It is absolutely essential for collagen production, the protein that gives your skin its structure and elasticity. After the age of 60, collagen production in your skin declines by approximately 1 to 2% every year. This is what causes the thinning, sagging, and wrinkling that we associate with aging skin. Vitamin A activates the genes responsible for collagen synthesis, working synergistically with vitamin D to maintain skin thickness and resilience. Robert was not my patient, but his wife Helen was. Helen was 72, dealing with severe osteoporosis and dramatic skin thinning that her dermatologist had told her was irreversible age-related change. Her skin bruised easily from the slightest contact. Her bone density was among the lowest I had seen in a woman her age. We optimized her vitamin D, added K2, magnesium, and then focused on vitamin A. Her diet was virtually devoid of retinol-rich foods. No liver, no fatty fish, no egg yolks, as she had been avoiding these foods for decades based on outdated cholesterol fears. We started her on a vitamin A supplement, 5,000 IUs daily from retinol, and encouraged her to incorporate cod liver oil, which provides both vitamin A and D in natural balance, twice weekly. Within 4 months, Helen's bone density measurements showed improvement that her endocrinologist called exceptional. But what moved Helen to tears was the change in her skin. The bruising that had covered her arms diminished dramatically. Her skin felt thicker, more resilient. Her dermatologist confirmed measurable improvement in skin elasticity during her follow-up visit, something he had not expected to see. Here is your implementation guidance.